a humble servant of Christ, and I am here and doing what he needs me to do. So I will start with my presentation, and then you guys at the end, then you can ask questions, or if you have a pertinent question while I'm presenting, then you are welcome to stop me and ask. Do I have the green light to go, Jacob?
Yes, we are
Okay,
all for your you.
okay. Get my PowerPoint up. All right, let's go to slideshow, and we're gonna start from the beginning. Hmm, I can't let's see. I'm sorry. Slide.
Okay, take your time.
There it goes. So once again, I'm Dr. Danielle Green Watson. I am a doctor of podiatric medicine. Podiatric medicine is pretty much a fancy word for podiatry or a foot and ankle specialist or a specialist for anything below the knee. So that includes your leg, your foot, your ankle.
Can I
Today,
help you?
someone saying something? Today,
Oh, who's got
Um,
21?
um, Mr. Mo, me pacho, Obia mu mute mo mo speakers no. We have the presenter on. Obia mu mute mo speakers no. I was just letting everybody mute their speakers. So, Dr. Watson, the floor is yours.
okay. So today, we will talk about introduction to essential lower extremity health, lower extremity meaning anything below the knee. We will go over a basic review of podiatric medicine, tips on lower extremity treatment and prevention of loss of limb, amputation, and or life, treatment of medical emergencies and trauma that have to do with the foot and ankle, and importance of podiatric medical care. So, a lot of people don't understand what podiatry is, what we consist of. They're quite confused. They come into my office thinking that all we do is clip toenails and that's it. Well, that's a podorthist. That is different from a podiatrist. There are two different entities. A podiatrist is educated medically. We have a residency training in rear foot and forefoot reconstructive surgery, and we are specialists who specialize. So, just a little bit about myself. Jacob bragged on me, but I will introduce myself again. I graduated with a bachelor's in science in molecular and microbiology, which was a very hard degree. And I'm telling my age because this happened in 2007. And then I graduated from the Barry University School of Podiatric Medicine in Miami, Florida in 2012. I did a 3-year surgical residency in the forefoot and rear foot with reconstructive surgery. I graduated from that in 2015. I am double board certified by the American Board of Podiatric Medicine and the American Board of Foot and Ankle Surgery and forefoot and rear foot surgery. And I currently own two practices. I bounce back and forth from Hiram to Douglasville to advocate and help both communities. And I am also the owner and operator of a newly opened medical foot spa. It is about 1 month old. And I'm a mother and wife, which is my most important job. Out of God can take away all of this, and I would just beg and ask him, just let me be a mother and wife. I have two beautiful daughters. I have a 4-year-old daughter. Her name is Savannah. And then I have a 15-year-old daughter. Her name is Madison. So our education, I kind of went over that. So you guys know I'm just not over here on here just talking out my butt. I know exactly what I'm talking about. I did 4 years of undergraduate to obtain my degree. Then I did 4 years of medical school, 3 years of surgical residency, and I felt like I had enough training, so I did not go into a fellowship. But podiatrists, podiatric surgeons sometimes do participate in a fellowship, but it is optional. So, what is podiatry? That's why you're here. So, now that you know that I am well educated and I know enough to talk about it, a lot of people are confused. Exactly what do you do? Like, what is it? Is it pediatrics? No, it's not pediatrics. Pediatrics is a doctor of pediatrics of kids. Is I going through my profession, a lot of people, I would say, I'm a podiatrist, and they'll say, oh, well, I have little Johnny. Can you see my son? Yes, I can see your son as a podiatrist, but I am not a doctor of kids. I am a medicine doctor of foot and ankle, lower extremity. So, what is podiatry? Podiatry is the medical care and treatment of the lower extremity. So that includes your foot, your ankle, um, your leg, anything that goes below the foot. But do I manage other pathologies? Yes, I do. If you have vascular problems, I can't just stick to your lower extremity. I got to work you up and make sure I have blood flow to that lower extremity. If you're a diabetic, sometimes I check your A1C or your blood glucose levels. If you have some sort of cancer, I'll work with the oncologist to move forward to decide if we're going to treat that cancer or will that lead to a below the knee amputation. So my field is a lot, but I can't include that in this PowerPoint because we will be here all night. And I know you guys have better things to do than hear me ramble on. So some of the pathology, so I just tried to keep it short. So when you guys think of podiatry or podiatric surgeon or foot and ankle specialist, we have different names. These are some of the pathologies we treat: Achilles tendonitis, plantar fasciitis. I know that is a big one. Ankle fractures, diabetic limb salvage, meaning that I will do whatever to save your lower extremity, bunions, hammer toes, and the list goes on. Who do we see? We see everyone from the time they pop out of the womb. If they have club foot, if they have flat foot, if they have a deformity, I can see your newborn children, and I can see granny or grandpa who walks in. I can see athletes. I can see teenagers. I can see pregnant women. Everybody. No, we do not see animals, but we do see everyone from zero to whatever. If they live to Moses' age, that's when we see them. Why this foot health matters. Why are you guys, I don't know how many people are on, hopefully it's 90, but why 90 of you are on here? Because foot health matters. Nothing can happen without your feet. You have to drive a car. You have to get to work. You have to walk to the grocery store. Your,
Yep.
your, your foot health matters. If you do not have feet, life just slowly starts to decline. Okay. So healthy feet are crucial for mobility, meaning walking, balance. If your feet are not healthy, you're unstable, and overall quality of life. It's hard to introduce yourself to a woman or a man and you're missing your feet. They're going to have a lot of questions. So it affects your overall quality of life. So that's why it matters. It prevents prevention of chronic pain. So I heard yesterday I had a lovely, I guess, presentation by an orthopedic surgeon. I'm sure they talked about hip and back pain and knee pain. If you are flat-footed or your feet turn out or you are bow-legged or all that, most of that starts, sometimes it starts at the hip, sometimes it starts at the knee, but mostly starts at the lower extremity, the feet. So if you correct the flat foot, then your knees are not bowed in, your hips are not turned in, and your back is not overloaded. So it can cause back issues. Early detection of health issues. I bet you didn't know that if I look at your feet, I can tell if you have rheumatoid arthritis, if you have psoriasis, if you have Crohn's disease or IBS, if you have thyroid disease. I can diagnose a lot of things by looking at your foot health, by the coloration of your skin, by lumps and bumps, by dryness of your skin, by changes in your nails. I can say, hey, have you ever been checked for psoriasis? Or have you had an x-ray of your feet for rheumatoid arthritis? There are things that I can diagnose by just doing a thorough evaluation of your feet. Reduce risk of infection and ulcerations. Infection. If you get an infection in your foot as a diabetic, you can definitely pass away. Okay. You can become septic, which is a bacteria in your blood from an infection from outside. It gets inside of the sore, and then you can end up in the hospital and dead if it's not treated within a certain time frame. And ulcerations. Ulcerations are just a fancy name for sores, deep sores, sores where you can see tendons and muscles and bones. So that's why it matters. We want to keep all of our limbs. Supports athletic performances. LeBron is not LeBron without LeBron ankles and LeBron's feet and LeBron knees and back and etc. all the way up. So a podiatrist, some podiatrists do specialize in sports injuries. Like I fix a lot of ankle fractures. I fix a lot of ruptured Achilles or ankle sprains. I correct those things. That matters because if you don't have everything right, you're most likely not going to participate in sports. Improves safety. Grandma is 85 or 86. She can fall. So if you have ankle instability, meaning your ankles are wobbly and your feet are not cared for, then that'll put you more at fall risk. And now you're fracturing your hip. And once you fracture your hip, granny and grandpa start to decline. So some common foot problems we have, I want to go over bunions, corns and calluses, ingrown nails. Those are some of the things I treat. Fungal infections, heel pain, diabetic foot ulcers, ankle sprains. Let's go back. Ankle sprains. So my day to day, I see about 30 to 40 patients a day, and this is my bread and butter. Okay. Most people walk in, they want to talk about bunions. They want to get their ingrown nails removed. They want to talk about plantar fasciitis. I treat all of that. And I probably do 3 or 4 ingrowns a day. I give out 30, 40 injections a day. Ankle sprains, I treat those. So these are common foot problems that a lot of patients around the area, well, in my area, that they present with. So, bunions. What are bunions? People come in my office and they think because they have a hump on their toe that they have a bunion or they have arthritis and they characterize it as a bunion. A bunion is a deformity in your big toe. It's the joint under your big toe. The toe goes kind of in and then the other bone's kind of out, and then you have a bump on the side. Well, we fix those. This is a patient I had. He was, I want to say, about a 48-year-old male patient. Actually just did his surgery 3 weeks ago. He had a bunion. As you can see, the large contracture you have right here. Okay. So it's straight up and down now. Don't worry about the second toe. He didn't want me to fix that one, so I ignored it, but that's a hammer toe. But this bunion, if it continues to grow as he age, it can cause an ulceration because it won't fit a proper shoe. So one of the most common things that I see in my office are bunions, and I love to fix bunions. I don't even think about it. They're just wonderful and fun for me. So if you have a bunion, it is very important because it can change the way you walk. It can change your pain. Do not wait until you're 85 or 75 to come in my office and say, hey, my bunion's hurting. There is nothing I can do for you at that age. So if your feet look like this and you are having pain, then you need to make an appointment with your local podiatrist. Diabetic ulcerations and amputations. So I'm going to spend a little time here because we all want to make sure that our sugars are controlled and we're controlling what we intake in our body. I just went to Jamaica with my husband. He is originally from Jamaica. He moved over to the United States when he was about 12 or 13 and then joined the military at 17. So he's been here, but he has not lost his accent. He loves the food. Everyone in my house is Jamaican, even though I'm American, but when you're a part of a culture, that's what you become. So we just went to Jamaica to celebrate his 44th birthday, and we stayed on a resort. I saw so many overweight Black people. So many. I mean, like overweight, like 300, 400 pounds. And it just disgusts me. Why does it disgust me? Because as a Black woman, yes, I grew up with the cooking. I grew up in a family where we met on Sundays. But at a certain age, you need to turn the plate away. Like it is unhealthy. Your body is your temple, and you need to honor that temple. By putting everything in your body that is unnatural, it is not the way God wanted us to live. So if it is your temple and you honor it, then you need to eat right and you need to exercise and you need to take care of it. because you are dishonoring God, because the Holy Spirit and Jesus and everybody, the Trinity, God lives inside of us. And if you are just violating that in every way, we need to stop that, because what does that cause? That causes diabetes, that causes hypertension. So people think you just go see your primary care and you take your high blood pressure and you get your metformin or you get your insulin and you're good to know. Go. No, that affects the lower extremity. I amputate toes every week. I amputate feet every week. And high majority of the patients look like me. Okay. So diabetic ulcerations and amputations. This is one foot I saw a couple of months ago. This lady presented in the office. She had a hole in her foot. She's a diabetic. As you can see, her foot is not shaped correctly. So she's putting a lot of pressure on that hole. The bacteria gets in the hole. The bacteria infects the bone. Once it infects the bone, you become septic. You have to come to the hospital. That's where you meet me, and I'm either cleaning it out, washing it out, taking cultures to treat the infection, hoping that the antibiotic that we put you on treats it, in hopes of not losing your limb. So another lady, we did Achilles surgery on her. She did not listen. She did not control her glucose levels. She dehisced, and now I am treating a wound to avoid a lower extremity amputation. This one, a guy, he diabetic. As you can see, it's round around the red around the area. This ulceration goes all the way to bone. I end up taking some of his bone out of his foot to heal this wound. Okay. All right. So, and the reason these breakdowns occur is because when your sugar levels are high, and this is layman's terms, sugar levels are high, your blood flow is not that great because diabetes affects that. You don't have the proper blood flow to the area, and then it kills your nerves. Okay, so your nerves die. That is called diabetic neuropathy. So you can walk around for weeks and not feel this hole stopping. So I will never forget this story. When I first graduated from school, my first job was in Maryland. My husband and I were stationed in Maryland. And it was a guy who came in, he had a wound, and we healed the wound, a wound care. He came every week. He disappeared for 3 months, came back. He had a new ulceration on the bottom of his foot. He was a diabetic and his nerves were not healthy. I could not figure out. He's like, Doc, where does this come from? I'm like, it looks like a pressure point. I took my hand and I put it in his shoes and I pulled out a Lego. He walked around with the Lego for 3 weeks. Where did the Lego come from? Him and his grandchildren were playing hide and seek, hide the Lego. So they hid the Lego in Grandpa's shoe. They didn't know they were children. Grandpa could not feel that Lego in his shoe and walked around for 3 weeks. By the time he made it to me, we were doing an amputation. Next topic, something that podiatrists can treat, trauma. This particular guy was a young guy. He was on the deck without shoes or fishing or something on the boat without shoes, and a big piece of wood lodged into his foot. So this is how he presented when I had to take him to the OR to take out the big stick in his foot and clean the area. I've treated guys who mowed the lawn, cut off their toes. I thought that was too graphic to put up here, so I held that back. But I have treated someone who shot themselves in the foot with a gun. So that's podiatry is made up of so much more than you guys could ever fathom. And then typical old ankle fracture. I am a surgeon, although I'm pretty and I'm nice and I'm sweet. I do get down in the OR. I can put an ankle back together. It's funny because my husband think I can't use a drill at home, but I use drills in the operating room. As you can see, I use screws. But at home, I just gave up. I just let him think I don't know how to do it so he can do everything. But I am a surgeon and I do fix ankle fractures. So if your local podiatrist, if you fracture your ankle, I would go to your local podiatrist. The difference between an ortho and a podiatrist. Um, The difference is that podiatrists specialize. Their 3 years in residency are specifically just the foot. So yes, we have rotation. 1 month I'm on trauma call, but the next month I'm on foot and ankle surgery. Then another month I'm on psych, but then the next month I'm on foot and ankle surgery. I think the average for orthos for foot and ankle surgery is about 3 months versus the podiatrist who is 3 years in their residency training program. So when it comes to foot and ankle surgery and trauma, we are well versed. Another thing I treat is cancer. You guys would have never thought about that, right? Why would a podiatrist catch and know cancer? This lady presented to my office. She showed me this picture.
In the front, then it opens the back.
She presented to my office with this picture. Okay. She said, a black lady, she said, I had this spot on my foot and it's just growing and it continues to grow. And I knew exactly what it was, but I didn't have the heart to tell her at first. I said, okay. I said, why didn't you come see someone? She said, because for a whole year I didn't have insurance, health insurance. This is what it started out as. This is what it turned into. When I saw it, I knew it was melanoma. Melanoma is a serious, serious, serious cancer that is malignant and can spread, and you can die from it. So when I first saw this patient, I cried internally and I knew what it was, but I couldn't tell her at first. So I took a biopsy, sent it off, and which a biopsy is a piece of skin, and I sent it off to pathology. And it came back as melanoma. I sat in my bed for 3 nights trying to figure out how I was going to tell her she was going to lose her foot because this could have been prevented. So I think we need to just take things like this serious. Any spots on your lower extremity, I've diagnosed squamous cell carcinoma. I've diagnosed crazy cancers. So long story short, she came into the office. I literally cried giving her results, and we just sat in that room and just cried and held each other. I had to send her to oncology for amputation, and she was about 35 years old. Vascular disease is a big, I guess in my practice, I see a lot of vascular disease. Vascular disease, so you have the blood flow that comes from the heart, which is the arteries, and then it crosses over and it goes up back to the heart and the veins to make it simple. You can have arterial vascular disease where it turns black like this, and your foot is literally gangrenous and dying. Or you can have venous disease where you create when you have ulcerations because the blood flow is pooling or just settling in the legs. So if your legs are overly heavy, is most likely venous blood flow. And it pushes the skin so much because the blood can't get pushed up back to the heart that it causes ulcerations. Both of these diseases are dangerous. This is an amputation I had to do. This lady went to the nail salon, got her nail clipped. She had vascular disease. She came to see me because her toe was turning black. And guess what? She had gangrene. She let the nail tech clip too deep because a lot of us, well, I don't, but a lot of people go to the typical clip and chip nail salons. Um, and it's a stereotype and it's not clean. They're clipping too deep. They are not professionals. They should not be removing your ingrown nails because this lady had bad blood flow. So when they clipped her and made her bleed, she got an infection, and guess what? No blood flow to the area, so it ended up being a amputation. All right, so I'm gonna wrap it up because I'm talking too much, but daily foot care tips. You have to wash your feet daily. I know that's crazy to be online and tell grown people to wash their feet, but there are grown people out there who do not wash their feet, who are not clean. And you have to dry. You have to dry between your toes. You are not to put lotion between your toes. Your toes are most likely together. So if you put lotion in between them, they're going to stay tight. And when you sweat, it's going to create fungus. So you just lotion the outside of your toes, just like you would do your hands. And you have to dry. If you do not dry and it's the inner space between your toes remains wet, that builds up and creates fungus. Moisturize. So important. Dry, cracked skin creates ulcerations. You need to check your feet daily for redness, swelling, infections, cuts, blisters. If you are diabetic, your eyes are not great. Okay. Stop thinking your eyes are great. You probably have diabetic retinopathy, which means disease of the eyes because you're diabetic, and then you're taking your hands, which are neuropathic, and your nerves are damaged, and you're taking these bad eyes and these bad nerves, and you're trying to make sure your feet are okay. That's not going to end up well for you. So have a spouse, have someone check your feet every day. Do not have a Lego in your shoe. Yearly visits to your podiatrist. I just say once a year, go. Unless you're diabetic. If you're diabetic, you need to be in that office at least 3 months. If you're a diabetic and you have a cut, scrape, scratch, you need to run to the podiatrist office. You are not to use grandma's salve. You are not to use auntie's potion. You are not to pour hydrogen peroxide on it. Hydrogen peroxide and Neosporin are the worst things to use. Okay, hydrogen peroxide, it can't tell the difference between good cells and bad cells, so it kills everything. And then that Neosporin, we are all immune to Neosporin. We've been using it since the 1800s. It does not work. Okay, so just make an appointment with your podiatrist. Oh, and I already said that. Proper footwear. Choose shoes that fit well. Okay. Do not choose shoes that are smaller. If you need to know your shoe size, you can go to your podiatrist or you can go to your normal shoe store and they will give you the correct size. Avoid high heels for prolonged periods. High heels cause a lot of tension in your posterior calf muscles. So yes, for a wedding or a nice event, but you should not be wearing them every day. God didn't create our feet for high heels every day. We're supportive insoles. Insoles meaning orthotics, not your Dr. Scholl's from Walmart. If you have those in your closet now, put me on pause and go throw them away. Okay? They are not supporting your foot. You need to contact your podiatrist and get proper inserts in your shoes to support the anatomy of your foot that will decrease your chance of future problems. Toenail care. Nail salons are dirty. Nail salons are dirty. Nail salons are dirty. They are using the same clippers they used on the HIV patient, the Hep B patient, the patient with fungus infection, the patient with bacteria infection. They are using those same clippers. They go put them in their oven. The oven does not heat up enough to kill the bacteria. You're taking your feet and put them in a dirty environment, and then you show up in the office trying to figure out where, why, when you got toenail fungus. It's because you went to the dirty nail salon. Nail salons are dirty. Toenail care. Cut your nails straight across. Do not go into the sides or you will be visiting my office. More money for me, less money for you. So you have to cut them straight across. Avoid cutting them too short. That will change the nail shape and it will start to grow into your skin. Seek care for ingrown nails, not at your nail salon. Pathologies that are determined through the changes, nail changes. I talked about this a little earlier. You can determine melanoma. Bob Marley, if you all know, you saw the movie, but he died from acral litiginous melanoma, which is a type of cancer. He ignored it, it spread. But if he had a good podiatrist and he went to see one, maybe if I was rocking and rolling by then, we could have caught it early. Crohn's disease, which is another fancy name for irritable bowel syndrome. I can diagnose that through the nail. Psoriasis, thyroid disease, particularly hypothyroidism. I can start to diagnose through the nail. So I'm going to ask you guys to participate. And I don't know if someone's raising their hand. I barely got this PowerPoint up tonight. So I have some questions. Guess what this is from? Anybody? Nobody. All right. Go ahead.
From the nail salon.
Could have been, but this is actually a sign, and thank you for your participation. I really appreciate it. This is actually a sign of Crohn's disease. So when I see this patient, I can tell that they have Crohn's disease because of the shape of the nail. Guess this pathology.
Something fell on the nail.
You said a what?
Something fell on the person's nail.
Good guess, but you're wrong.
Is
This
it anemia?
no, this is melanoma.
Mm.
This is melanoma. And a lot of Africans, African Americans, people of African descent, they have streaks in their nails. And I see a lot of them. And I'm not really worried about that. And let me tell you why. Because our melanocytes, which are the beautiful brown cells that God gave us to produce color, they line up in our fingernails and our nails and they express streaks. Okay. I become concerned when it looks like this in Black people. Okay. I become concerned when it looks like this in Black people. The streak is going past the border. But something like this in Black people, not so much. But when I see the Caucasian race, European descent with any of these, this is melanoma most of the time. So this is what Bob Marley ignored. Guess what this is?
Definitely fungus.
I'm glad you said that. You're smart, but wrong. This This is psoriasis. Psoriasis is an inflammation of the skin. So a lot of you guys, I love that you guys are participating and getting them wrong because I can talk more. A lot of you guys go to your local Walmart or Target. I'm boycotting Target, by the way, but if you still go to Target, you will go to the foot and nail aisle and you will buy that antifungal and you will put it on until the cows sing home. This is not fungus, y'all. This is psoriasis. Okay?
Mm.
Guess this pathology.
Fungus is the only one left on the board right now.
Calm down, you get a prize. This is fungus, okay? So it is treatable. Stop letting people tell you that it is not treatable. I've seen this turn clear. If you make an appointment with your podiatrist and they know what they're doing, it can turn clear. There is topical, there's oral, there is laser. There is somebody there to get all that nasty stuff off while you're putting the medication on. So this is fungus, and I see this all the time. I love to treat fungus because I do not have to think. Like my medical assistants, I do not have to think. I'm in there, but it can get bad. Nobody wants to look at this. So if you have this on your toes, please reach out. Okay, so thank you for participating in my game. When to see a podiatrist? Persistent pain, non-healing wounds, diabetic foot infection, signs of infection, any lumps, bumps. I've taken out tumors in legs. Okay. So definitely any lumps or bumps, any skin changes, any sports injury, anything in the lower extremity, you want to see a podiatrist for. Foot care is critical for diabetics. I hope that I drilled it into your beautiful, lovely minds. It is so important to see a podiatrist. If you do not, I tell my diabetics, we dating. You my boyfriend, you my girlfriend. We dating. We in a lover triangle until the God call you home. I am like number 3 or 4 in your life. Like you might as well put me as the emergency contact in your phone because we dating now. And it's just a relationship you have to have. It is not something you wait around and treat for weeks and pour hydrogen peroxide on or try to soak it. You know, Black people love to soak it in Epsom salt. I don't know what it is about Epsom salt, but y'all love Epsom. Epsom salt is doing nothing but a pool of infection. So please stop doing that. So yes, it is a very important relationship that you have to have with your podiatrist. Now, they're not all going to be like me, but there's some good ones out there. I have hope. Okay, summary and key takeaways. Inspect your feet, wear shoes, see a podiatrist. Fun fact, and then this is open for discussion. This is just a fun fact. There was a survey conducted. I can't tell you when and where. It was passed along through cohorts of mine. in a hospital. So every hospital has residents, right? So like Grey's Anatomy. They have a lot. I don't remember Grey's Anatomy. Doogie Howser have residents. So we practice we're doctors in the hospital, but we're practicing, right? So every hospital has services. So if you have a residency-based hospital, you have internal medicine residents, you have orthopedic residents, you have psychology or psychiatry residents, you have neurology, the list goes on. So everybody consults everybody. So if I'm a podiatrist and I need the right antibiotic, I'm going to call the infectious disease resident. And I'm going to say, hey, buddy, if my patient doesn't have blood flow and I got to do surgery, I'm calling the vascular resident. I'm calling, hey, I need you to come in here and revascularize and get some blood flow. So my patient is crazy, I'm calling the psych ward. Okay. So we all communicate. So a study was performed in a hospital, and they said if there was one service that you could not live without, and there's so many specialties of medicine. If there was one service, you cannot live without in the hospital, which residents would you want? And guess who they said? Podiatry! Of course! We keep the world moving. What would you do without us? You wouldn't be able to walk. So that kind of tickled my pickle. I was excited about that. I was like, yes. So podiatry, of course, it is so important. And I hope you guys are more educated exactly about what we do. I pulled up in the drive-through at McDonald's one day. I don't eat McDonald's. This was like 20 years ago when I was 20, y'all, so don't judge me. I haven't had McDonald's in a long time. But I pulled up at McDonald's because I was living on a budget and I was a resident. And the lady said, you're a podiatrist. I guess she saw my shirt and she was like, you can clip my toenails. I got so angry. I was like, that is not what I do. Yes, we do it for diabetics, but we do so much more. So, and now you know. Any questions?
Right. We